Hey, thanks for checking in. Today we'll be going over the AARP Medicare Supplement Insurance Plans insured by United Healthcare Insurance Company. We are Legacy Insurance Group. We've been selling Medicare plans for about 12 years. So we have a vast amount of knowledge and we have a number of agents that can help you navigate through your Medicare options. Today we'll be talking about the relationship between United Healthcare and AARP. We're going to learn about your choices. We're going to show you how to upgrade your coverage and how to take charge of your health care using the Medicare supplement plan that best fits your needs. All right. So to your far left, you have United Healthcare, been in business for about 50 years with an A+ rating by AM's Best. United Healthcare's coverage covers more people with Medicare supplement plans nationwide than any other individual insurance carrier. Very strong plan. AARP, your far right, focusing on bettering the lives of members, providing access to quality programs and services like the AARP supplement plan. So it tells you a little bit about the strength of United Healthcare. Let's learn about your choices. All right, here's where it starts getting exciting. All right. These are your Medicare options. So step one, assuming you've picked up Original Medicare. So Original Medicare is Medicare Parts A and B. A being your inpatient coverage, covers hospital stays and any kind of care that where you spend the night considered inpatient, okay? And then you have Part B that covers your doctors and outpatient visits. So you have inpatient and outpatient covered with Original Medicare. Once you have step one covered, step two, you have a couple of options. You can decide option one to pick up a Medicare supplement insurance plan, also called Medigap. What does that mean? What is Medigap? Well, when you have Original Medicare, Parts A and B, there are co-pays, co-insurance, and deductibles that you have to come up with financially. So there's some financial exposure for you there. The Medicare supplement plan or the Medigap plan will pick up the gaps in coverage and pay those costs for you. Now, wow, that sounds fantastic. How do I get that done? Where most of the time, the Medicare supplement plan has a monthly premium. So you're going to pay a monthly premium every month, but the Medicare supplement plan will pick up any financial exposure that Original Medicare leaves behind. And if you select that option, you're also going to have to pick up a Medicare Part D prescription drug plan. Both of these plans, the Medicare Supplement Insurance and the Medicare Part D plan, are all picked up by private insurance companies like United Healthcare. Or you can go with option two. Option two, you're going to take your Original Medicare card, your Original Medicare Parts A and B, and you're going to put that in a safe place, and your Medicare Advantage Part C plan becomes your primary insurance. Now, the difference is with option one, Medicare Parts A and B, your Original Medicare, is your primary insurance. The supplement is your secondary coverage. So you go to your doctor's office with option one, you're going to show your Medicare card, your Original Medicare card, and your supplement card. So they can bill Medicare as a primary, then any gaps in coverage the supplement will pick up. Now, option two, you're going to put your Original Medicare card away, and the Medicare Advantage Part C plan becomes a replacement plan, and you're going to use that one plan for all of your medical services. So it will combine your Medicare Parts A and B. There should be some additional benefits. In most cases, there are some additional benefits like dental, vision, hearing, and that kind of thing, over-the-counter benefits, that of that sort. And you'll also have prescription drug plan coverage within the plan in many cases. So it's an all-in-one plan, and you don't have a monthly premium like the supplement. You pay as you go. So you have zero monthly premium most times. Now there are a few that have premiums, but for the most part, your Medicare Part C won't have a premium, and you'll just pay co-pays as you go along. Now, here's a little bit, we'll get a little bit more involved in what the different parts of Original Medicare cover. So Part A is, again, like I said in the previous slide, inpatient coverage, right? So inpatient hospital, inpatient mental health care, skilled nursing, and home health care. These are situations where you're an inpatient for the most part. It also covers hospice care and some blood work in case of transfusions as an inpatient. Now your Part B is your outpatient stuff. You'll see your primary care physician, specialist, outpatient, ambulance, lab work, blood work, preventative care, medically necessary durable equipment. All that good stuff is covered under Medicare Part B. All right, so here is in a nutshell how Medicare Part A works. All right, if you are hospitalized, so let's say you just got Medicare, you go to the emergency room, they say they're going to keep you, you're going to become an inpatient here, you are responsible for the deductible, all right? And it covers you for the full 60 days. So you have $1,632 that you are responsible for. Now, you're an inpatient, you pay your $1,632, you're there for 2 days, you go home and you come back 3 days later because you're still not feeling well. You don't have to pay that $1,632 again. You're covered for up to 60 days in that benefit period. If you're there that full 60 days or you use that full 60-day period, days 61 through 90, it's all covered except for $408 per day. You are responsible for $408 per day. Now again, this is original Medicare, all right? If you are just on A and B. If you're still unlucky enough to be in the hospital days 91 through 150, you will be using your lifetime reserve days. Everything will be covered except for $816 per day. And there's nothing beyond 150 days after using your lifetime reserve days. As you can see, there's a lot of financial exposure, like we said in the last slides, if you only have original Medicare. Skilled nursing facility, you can see there days 1 through 20, 100% of approved amount. And then days 21 through 100, they cover everything but 204 per day, so you have some costs there. And then days 100 plus, there's no benefit for you. So again, recap your cost: $1,600 first 60 days, $408 per day if you're in there longer than that, and then 91 through 150, you're $816 a day. And you can just kind of read so forth and so on in terms of what your costs look like. All right, now let's talk about your Part B. Medicare is going to pay for your outpatient services. They're going to pay 80% of the approved amount once your annual deductible is met. So first time into the doctor's office in the calendar year, you're responsible for the first $240 deductible in that calendar year. After that, you're going to pay 20% of the approved amount, the amount that Medicare will approve. You're going to pay 20% of what they charge, okay? All right, let's talk about upgrading your Medicare coverage. So your Medicare supplement plans are for people on Medicare Part A and B. Think about your Medicare Part A and B like a small boat, right? You take it to the water and you realize there's some gaps, there's some holes in your boat. Your boat starts to sink a little bit and more. And there is no maximum as to how much it can sink if you're only on A and B. The supplement plan will pick up those gaps and make sure that boat stays afloat. Just a little analogy for you there. Benefit levels vary by plan. There's a number of different Medicare supplement plans. Typically, the more comprehensive, the higher the monthly premium, right? All right, now let's talk about some of the advantages of the Medicare supplement plan. I mean, it is a fantastic plan, guys. We've been doing this for a long time. They are fantastic. Any hospital, any doctor, any specialist across the United States, no authorizations, no referrals needed. It is fantastic. Low to no copays, making your annual budget very easy, right? Once you have your monthly premium, you multiply that by 12, you know how much you're going to pay a year for your health care. Now, always also remember, you do have that $240 deductible. So it's the deductible and then the 12 monthly premiums, and then you know how much your health care is going to be. I mean, it's just fantastic. Coverage anywhere, anytime. So your coverage goes with you while you're traveling within the U.S. And a lot of times you'll have an out of the country benefit as well. Are you eligible? Will you be enrolled in Part A and B at the time your coverage begins? Are you 65 years or older? If you can say yes to those questions, then there's a good chance we can get you on a Medicare supplement plan. All right, so we're going to talk about how Medicare Part D works. Now, if you have a Medicare supplement plan, that again, the difference between the supplement and the Advantage plan has prescription drug plan rolled into it, but we're digging deep into the supplement plan. You're more than likely going to have a standalone prescription drug plan. All right, they are Medicare approved private insurance companies that contract with centers of Medicare and Medicaid services like United Healthcare, and you'll be able to enroll in a standalone Part D. All right, when do I enroll in a Medicare Part D plan? 3 months prior to turning 65, the month of, and 3 months after. That is your initial enrollment period, and you can enroll in a Medicare Part D plan, which will be effective the month that you turn 65 if you enroll in the plan months leading up to turning 65. All right, let's take charge of your health care and show you how we get you into a plan that makes the most sense for you. I really do think these are fascinating numbers when you start speaking about United Healthcare and their Medicare supplement plan. It's the number one Medicare supplement plan with 1 in 3 Medicare supplement beneficiaries enrolled in an AARP Medicare supplement plan. Your average annual rate increase, about 4.1% between 2017 and 2022. And that's a big one, guys. I mean, there's a lot of plans out there that will give you a less expensive starting rate. Then you find out a year or two from there that you are more expensive than this particular supplement plan. I've seen it firsthand a number of times. The Medicare supplement plans that carry the AARP name are endorsed by AARP. They're one of this particular kind. And they're offering Medicare supplement plans in all states and in most U.S. territories. 95% of insured members are satisfied with their Medicare supplement plan. They don't move much. We get you on a supplement plan, typically you are satisfied unless there is some special case in which you can speak with us and we can talk to you about options going forward. 98% of claims are processed in 10 days or less, and 94% of active insured members are currently renew their AARP supplement plan. 94%, I mean, that's fantastic. Value, they do have an exclusive gym membership infused in the Medicare supplement plan at no additional cost, and the competitive rates and discounts. I mean, it's just a fantastic plan. Trusted by more than 4.4 million members and backed by more than 50 years of experience and expertise. They have great prowess in their products. 94% of plan holders would recommend their plan to a friend or family. I mean, that's huge. For a plan their size to have those type of percentages, I mean, that's saying a lot. All right, here are the different supplement plans that could be available to you. I want to speak really quickly about, if you look at the far right, you do have Plan F, right? Plan F is only for folks who were first eligible for Medicare before 2020. All right, so if you got Medicare after 2020, good chance you can't get Plan F anymore. But let's speak about the very next best option in terms of coverage. Plan G, furthest plan to the left, is the most comprehensive plan next to F. The only difference between F and G, with G, you have to pay the $240 deductible. Plan F, you didn't even have to pay that. You paid your monthly premium and there was nothing else to pay on the medical side. Except foreign travel. I mean, that's if you're gonna go outside the country, yeah, okay. They'll cover up to 80% for both of those. But Plan G, I mean, covers all of your Part A, Part B. It picks up the deductibles, any excess charges. It just covers just about everything you need there. Okay, again, we spoke about the charges that come along with having original Medicare alone, right? You see there your Medicare A deductible, $1,632. You're in the hospital for 1 day, you're responsible for $1,632. All right. Plan G, you pay nothing. All right. And remember, we're saying at days 61 through 90, you're paying a daily copay of $408 per day. Plan G, you pay nothing. Same with your skilled nursing insurance. Days 21 through 100, you're paying $204 a day. Plan G, nothing. Your annual Part B deductible, that's the one thing you will be responsible for. Medicare is going to cover the rest, but you're going to pay the $240 deductible the first time you're in, or first couple of times until you pay that $240. And then your medical services, like going to see your primary doctor or specialist, or having some sort of surgical procedure. Medicare is going to pay 80%. You're responsible for 20% with original Medicare, but with Plan G, you have nothing to pay there. So you can see it's very comprehensive. You don't have to worry about coming out of pocket much with Plan G, other than the $240 deductible and your monthly premium that you're going to pay. All right, so let's talk about some discounts you can pick up. So you do have a $2 discount. You can take off your total monthly household premium if you pay with automatic monthly bank withdrawals. There's a 7% discount if more than one member in the household enrolls into an AARP Medicare supplement plan by United Healthcare. And then you can save $24 per year, right, off the annual household premium if you pay in full, your full premium amount at one time. So you have some savings there, you have some options. There's your gym membership. We talked about Renew Active. So there's the benefits of that. That's your gym membership. You do have a dental discount if you use Dentegra, and we can speak to you a little more closely about that. And you do have a vision discount of $50 towards eye exams at participating providers. Lens crafters, you can take an additional $50 off the vision discount. So you do have some additional benefits with the Medicare supplement plan. Hearing discount, you have the 24/7 nurse line, and you also have a refresh your driving skills with AARP Smart Driver course. Brain health, staying sharp assessments. They really do work hard to keep you healthy in all regards. All right, so in order to enroll in a AARP Medicare supplement plan, you must have an AARP membership. You have access to a bunch of discounts: groceries, car repairs, electronics, health and wellness, subscription to the AARP magazine, travel discounts, and more. So they would like to have an AARP membership present when it's time to enroll in the supplement plan. All right, so I want to thank you guys for listening in. We would really like to help you navigate through your Medicare options, whether it's the AARP Medicare supplement plan or any other plan, the prescription drugs, Medicare Advantage, whatever it is that you are interested in. We can definitely speak to you about your options. We are a Legacy Insurance Group. My name is Michael Spignor. We have a lot of agents here today that can help you, but my contact information is here. But I'm sure anyone from our team would be happy to help you. So thanks again for listening in, and have a wonderful, wonderful day.